Good morning, everyone. My name is Alice Crean, and today I will be presenting on the mental health challenges in cancer care. So just to go into my why, for me this topic is more than just academic. It's something that I've personally lived through. My mother has been diagnosed with breast cancer twice. Throughout her journey, I not only saw the physical toll of treatment, but also the deep emotional and psychological strain that often went unnoticed. Experiencing this personally made me realize that mental health is just as important as physical health. Now, before diving into the data, I just want to go over some key terminology. So psychosocial oncology is what I'm going to be looking into today. It's the study of psychological, social, behavioral, and emotional aspects of cancer for both patients and their families. A comorbidity is when someone has two or more health conditions existing at the same time. And today we'll be talking about cancer and mental disorders. And finally, a malignancy within the context of cancer refers to cancer cells that can invade other tissues and metastasize to other organs in the body. So the research shows that this is a very widespread issue. A meta-analysis across 14 countries found that 44% of patients suffer from mood disorders, including depression and anxiety. Nearly half of patients are struggling with a mood disorder. Even more concerning, nearly 3 out of 4 patients with depression receive no effective treatment. For some, the emotional toll becomes life-threatening. About 8% report suicidal thoughts, especially near the end of life. And this risk is not spread evenly across all cancers. Studies show that patients with mesothelioma face more than a 4-fold risk increase of suicide compared to the general population, while those with pancreatic cancer are almost at 4-fold. Even esophageal and stomach cancer more than double the risk. This makes it clear that suicide is not rare or distant possibility. It is a direct and measurable consequence of untreated psychological distress in cancer patients. This is not a side note, it's a serious public health crisis. Several systemic and cultural factors contribute to this gap in care. First, oncology prioritizes treating the tumor itself over addressing the emotional well-being. On top of that, structural challenges like limited insurance coverage, a shortage of mental health specialists in cancer centers, and practical barriers such as transportation or scheduling conflicts make it even harder for patients to access support. Social stigma adds another layer. Many patients hesitate to share their emotional struggles for fear of being seen as weak, ungrateful, or complaining when their life is being saved. High-profile examples can help break the silence. For example, Kate Middleton, the Princess of Wales, who is now in remission, has openly discussed her struggles with anxiety and depression while undergoing cancer treatment. In an interview, she stated, "You sort of put on a brave face, stoicism, through treatment. Treatment is done, and then it's like, okay, I can crack on, get back to normal. But actually, the phase afterwards is really, really difficult." Her openness highlights that mental health challenges can affect anyone, regardless of social status or resources, and seeking help is a sign of strength, not weakness. All of these factors, clinical focus on the tumor, structural barriers, and social stigma combine to leave patients without the support they need, even when effective interventions are available. While anxiety and depression are the most common, cancer patients can experience a variety of mental health challenges, such as mood disorders, sleep disorders, eating disorders, and post-traumatic stress. These are often worsened by treatment side effects like medications, surgical recovery, and fatigue. Encouragingly, research shows that interventions such as counseling or mindset coaching can improve patients' quality of life significantly. The emotional burden starts the moment a patient hears you have cancer. But the financial burden can make mental health care even harder to access. In 2015, Thomas Insel, then director of the National Institute of Mental Health, said that mental disorders act as a gateway to a range of other costly public health problems. The risks he describes were contracting HIV, developing heart disease, pulmonary disease, and diabetes, as well as raising one's risk of homelessness, poverty, institutionalization, and incarceration. For low-income oncology patients, financial strain exacerbates psychological distress. Direct costs such as insurance premiums, co-payments, and travel expenses, combined with indirect costs like low wages, from missing work may force patients to forego therapy. Even when hospitals have free resources, massage, wigs, counseling, patients often don't use them because they don't know they exist or they cannot fit them into a packed treatment schedule. On this slide, you can see a chart from the World Health Organization that Thomas Insel highlights in his book. It shows the top cause of time lost to disability worldwide, and what stands out is that mental and behavioral disorders make up the largest share, 26%. That's more than double the next category. This makes it clear that mental illness is not a secondary concern, but one of the leading drivers in disability across the globe. And yet, as Insel points out, mental health receives very little investment compared to its impact. Globally, governments spend less than $2 per person each year on mental health. In low-income countries, it's often less than 25 cents. On average, less than 3% of health budgets are devoted to mental health, even though these disorders account for over 20% of all healthcare costs. In the poorest countries, the situation is even worse, with as many as 85% of people with severe mental illness going untreated. This lack of funding and access is especially alarming for cancer patients. They already carry heavy financial burden and medical. Even when mental services are so underfunded and difficult to access, the care and gap only widens. This being said, cancer is not an isolated illness. It affects entire family systems. Children of parents with advanced cancer may experience academic decline, social withdrawal, and heightened health anxieties. Spouses frequently report depression, anxiety, and marital strain. Empirical research demonstrates a bidirectional relationship between patient and caregiver mental health. Psychological distress often worsens the well-being of the other. Given these interconnections, comprehensive cancer care must incorporate family counseling and caregiver support as integral components. Now, into the solutions. There are several backed by research, beginning with collaborative care models, which encourage active communication between members of a patient's care team. Oncologists, primary care doctors, and mental health professionals and social workers coordinate care. This ensures emotional health is addressed alongside cancer treatment. Following that, support and counseling allows patients and families to openly share their hardships with an experienced individual. Dana-Farber Cancer Institute's one-to-one program is a great example of this. They have over 200 trained volunteers who speak with patients by phone, email, and in person, sharing tips, empathy, and hope for patients. This not only reduces isolation, but also provides practical advice that medical staff might not think to mention. Immediate access to counseling is another option for patients. Meeting with a mental health professional shortly after diagnosis can help patients process the shock and begin coping effectively. Some centers even provide diagnosis day counseling, where patients meet with both their doctor and a mental health professional in one visit. This allows the patient to gain a sense of control over the situation. Following this, regular mental health screenings for both patients and caregivers can catch problems before they escalate. Regular check-ins, whether through short questionnaires or quick conversations, can catch problems early. This is a cheap, fast, and scalable solution that can prevent more serious mental health issues from arising later. Even if these services exist, they must be affordable and accessible. Expanding insurance coverage, offering free on-site counseling, and using telehealth can help break down these barriers. During the pandemic, teletherapy showed that distance is no longer a valid excuse. For patients in rural areas or those too sick to travel, this could be a permanent, life-changing solution. Mental health challenges are more than just a side effect of cancer. They're a critical part of patient care. The psychological burden of cancer is neither incidental nor secondary. It is a fundamental detriment of treatment adherence, recovery trajectory, and overall quality of life. Mental health care must be embedded into standard oncology protocols, with services offered early, made financially accessible, routinely monitored, and normalized as a part of comprehensive treatment. By prioritizing mental health care for patients and families, we can shift the focus from living longer to living better, with dignity, resilience, and emotional well-being. Thank you.
Okay, panel.
I would just like to start by saying I love your vulnerability and the emotion that you showed. I just want to acknowledge the beautiful journey that you and your mom have shared and how impactful this has been for both of you. And just,
Thank you.
Yeah.
Yeah, kudos to you, Alice.
Thank you.
You know, this is not an aspect of cancer that I've ever considered before. So, congratulations for bringing awareness to it and doing it well.
Thank you.
Thank you. I was just wondering, do you know if there's, like, depending on where you go, does it vary? Like, cause before you got to your solutions, I had written down after diagnosis, is it required to see a counselor or a therapist?
So it's not exactly. It definitely depends on where you go, which is a part of the reason that we really want to spread awareness and make sure that we're giving equal access to patients, especially low-income patients or those who can't travel, rural areas, all of that. In my personal experience with my mom, because we moved states between her diagnoses and went through different hospitals and their resources, it's definitely each hospital provides different resources. They all tend to do their best to provide what they can. Some offer, the diagnosis day counseling, family centers, all of that, but it's limited in each.
Okay. And then I had another question too, and I was thinking of this from a presentation that a student did last year looking at gut microbiome health and how like different drugs can impact that and how that can affect your brain. And I just didn't know if in your research, if you found anything, like obviously hearing you're diagnosed and having to figure out like how to do it, like that's huge. But I didn't know if there was anything between the drug itself and impacting the cells in your body. And does it impact your gut microbiome? Does it impact your brain chemistry?
I didn't exactly look into necessarily the effects on like the direct physical effects in terms of the gut microbiome and the brain chemistry, but of course each drugs have their side effects, with the chemo pills or a variety of things, and that from the symptoms that they give you, nausea, some cause depression and anxiety, they definitely have their individual defects that we can see externally. However, internally, I would love to do more research into that.
Thank you.
Alice, I applaud you, and we've had some conversations, and when you presented in front of me, can you speak to the issue that I think is really important here, is that there has been numerous studies that talk about, cancer is never an easy diagnosis. Of course, it depends on the kind of cancer and the staging of the cancer. But the reality is that you will hear over and over again from people who are in the field of oncology that patient attitude goes a long way in helping the success sometimes. That where you have two patients, one with a can-do kind of, even at the times that they can be very debilitating and difficult, versus the patient who becomes resigned from the get-go. There's a difference. Have you seen those studies that talk about that issue, and that's why it's critically important that mental health be addressed, so that people are trying to manage their disease and stay positive and look for the hopefully outcomes that everyone wants to see happen? Is there definite studies that have been demonstrating the correlation?
Yeah, I have, and that was actually one of the topics that I was hoping to go into in the beginning of my research, is solely looking into that. I've definitely found concrete evidence of it in studies. I just didn't feel that I had enough to make an entire presentation on it. But even just the getting up every day to go to chemotherapy or radiation because of the side effects and how much pain it causes them. It's crucial to getting through each stage of your treatment plan, and that's really where we see the resilience come into play and affecting treatment adherence.
You talked about two other, things people don't like to think about when, no one likes to think about cancer in general, but the financial toll of cancer is a big issue, and that some people have greater resources than others. Some people can fly to Boston or places, New York for specialized treatments, and others cannot. So that's an issue. But I'm noticing increasingly on ads for cancer drugs, discussions about support groups that are through social media, where people with similar diagnoses and who are going through similar issues now have a way to connect with each other. And this sort of, it's one thing to talk to someone who is not going through what you're going through, and they'll tell you, well, we're with you and all that. It's much more efficacious to have someone who is experiencing and having to do the same things that you do. They understand a little bit more, and having those. What I'm trying to get to is that I've been wondering if in this push for greater access to mental health, this would be a very efficacious tool to try to continue these sort of networks that are being produced, not only regionally, but sometimes nationally, that give people access to information, to support. They're kind of like self-help organizations of people who are all the same club, so that you have people who really can understand and identify what you're going through, other than the people who are sort of just observers.
Yeah. I think social media really does offer a great outlet of support and, finding your peers who have gone through similar things. And I think that, like what I talked about with Dana-Farber, their one-to-one program, there are numerous sources through cancer centers and online. And I think the goal of that is to, of course, find you someone who has gone through something very similar, as opposed to, someone who's had cancer. They really aim to find someone who's gone through similar treatment or type of cancer, and make sure that they are trained in uplifting you and giving helpful tips, rather than social media, which you're not exactly sure what you could get out of that. So I think it's an alternative that is more widespread, but the cancer centers offer a more trained program.
Is the increasing incidence of celebrities coming forth and talking about their own diagnoses, because there's been a slew of them in the last several months, where high-profile people have come out and said, well, I just got diagnosed with this kind of cancer. Does that, it doesn't just necessarily address the mental health issue, but does it help people who might be suffering from that same condition realize that, this is a equal opportunity disease that anyone can get, like Kate Middleton, as you mentioned?
Mm-hmm.
Does that help in any way, help people feel that, okay, I'm in the same club, where she's in the club that I'm in, and she understands?
I would say that, it's a bit of a slippery slope with that. I would say it depends how these high-profile examples address the issue, because the main concern would be that they add to the social stigma that I was talking about a bit, that depending on how they go about addressing this, cancer patients may be concerned that they have to feel exactly like these examples that are coming out and gaining a lot of support from media. And so I think Kate Middleton is a great example of, she came out after dealing with her treatment in private, and she's now doing her best to advocate and to spread awareness about the mental health issues, not only during treatment, but after treatment and after diagnosis.
I have a quick question for you. You mentioned that mental health does not receive a lot of funding, and I was wondering what are the barriers to that?
I would say that, facilities definitely have limitations, as well as insurance plans have limitations. I believe it was in 2008 that it was a national act to include mental health more in these insurance and coverage plans. However, that was a definitely unexpected find in my research was Thomas Insel's, addressing the cost of mental health versus how much it's actually covered by these facilities and insurance plans. So I think they're working towards providing the research to these facilities and insurances that it is a necessary cost to include it within the plan.
Going off what you just been mentioning it to several of your classmates here, being able to cite key researchers like you just did with Mr. Insel, and citing figures and statistics is super, super important. I'm really glad that you included that with your sources up here. To be taken seriously as a researcher, you have to give credit to these sources and demonstrate that you know who are the key people in your field researching this. So good job on that, and including sources from JSTOR. And finding reputable places to find information is super good. So I just wanted to mention that because I think that's really important in any presentation, no matter what subject area you're doing. Good job.
Thank you.
I'm wondering if medical schools have introduced this into curriculum in any way, particularly for those who are going to specialize in this area, like gynecology, whether they are talking about this really important aspect, byproduct, if you will, of a diagnosis. Did you come across anything where they're starting to address this in medical school?
So what I did come across, I reached out to, she specializes in psychosocial oncology at Dana-Farber. She's a professor at Harvard Medical School who went through Harvard Medical School, and I reached out to her to get her opinion. I didn't get a reply, but it was really interesting to look into her background in this, and she does teach a class on psychosocial oncology. She was specially trained in it, so she is an oncologist, but she is very active in the role of being that mental health provider, even in fractured care structures, as opposed to collaborative, where someone may not have a mental health specialist. So there are definitely examples of it within medical schools.
Great. Any other questions? All right, Alice, thank you very much.